As we shift the focus back to the health front, since that seems to be the driving factor here, as we said, plans underway with a 2 p.m. press briefing expected here from New York Governor Andrew Cuomo, joined by the governors of New Jersey, Pennsylvania, Delaware, Connecticut, and Rhode Island, potentially giving a plan for reopening pockets of the economy across those states. And for more on whether or not we're actually at a point where we might be too quickly thinking about that, I want to bring on Dr. Joseph Vinetz. He's a Yale Medicine infectious disease specialist, and he joins us now on the Google Hangout. Dr. Vinetz, thank you so much for joining us. First off, there's been a lot of pushback to the idea of opening the economy too soon for what it might trigger in terms of secondary infections and potentially having to do this all over again. So what's your take looking at the data that we've seen so far, and still question marks around whether or not those who have already recovered might be able to be infected again? What's your thinking right now?
Hi, Zach. Thanks for having me. So I'm not sure that what people are saying that, oh, in the fall, the cases are going to start coming up again. I'm not sure that they've even stabilized. Just because they're growing less fast than they were before doesn't mean anything's stabilized. We have an increased number of cases, period. We know that about 1 or 2% of all the cases end up being very severe and leading to death. A few more percent of those cases get hospitalized, and that's still going up. There's no reason to believe that cases have stabilized, and I'm a little disappointed that our CDC director even said that. That being said, there's been a lot of interest in how do we release people to go back to work, and everybody's very focused on the antibody testing. And antibody testing means literally that people, once they've been infected, make antibodies against this virus. What we do not know is whether antibodies against this virus mean that people are protected from getting infected again. We hope so. We think so. Evidence with other SARS-related viruses, like the original SARS or the MERS virus, seem to indicate this, but we really don't know. And so to rely on an antibody test to release the economy, I think, is a little bit short-sighted and devoid of facts at this point. But if you just think about it, we have a little over 500,000 cases and about 20,000 deaths as of today. If we figure that we have at least twice as many cases, let's say we have 5 times as many cases, that would be 2.5 million cases, just because our testing isn't good enough. That's not even 1% of the nation's population being infected at most. And it's clearly going to be less than that. And so I think we're going to have rolling waves of infection going through our country, through our society. And then we have to make a policy decision with our politicians, our elected representatives, on how much of a health hit are we willing to accept in exchange for getting our economy back. And that's above my pay grade, my friend.
Well, I think it's above a lot of people's pay grades, and I think it speaks more to the idea that it wouldn't be one person's decision, and we're kind of seeing that now with the governors coming together. But as we've discussed on this show, each state looks different in the population makeup. We talked about Florida potentially having its own set of problems with an older population in certain communities. But when you look at it, I mean, we got the update from Dr. Fauci saying that these antibody tests could be coming as soon as the next few weeks. But even when you look at that front, as you were just saying there are still a lot of question marks about what that would even mean if you do test for antibodies and how such little is known about COVID-19. Right now, if you're operating off of what has already been shaky grounds for data, when you think about our lapse in testing, you're then building on it by saying, all right, we're going to build more decisions based on maybe perhaps faulty data here with antibody testing. So, I mean, at what point does it start to just become what the policymakers in charge here, mainly President Trump and the state governors, want to do to open things back up, where it's basically going to be, all right, this is a decision, we're going to have to live with it?
Well, I think as a society, we need to move in that direction. All we can say from the scientific and epidemiology points of view is, here's how many people have been infected, and here's how many people are at risk. And what we don't know is whether antibody testing makes somebody not at risk. That's really a big question. And that we don't, if somebody has antibodies, that means they're protected. The only way we can find out, my microphone went off.
Yeah, you're back now.
Okay, so let's say you have, Zach, let's say you have an antibody test and we put you back to work. Are you going to be susceptible to getting infected again? Well, we don't know that, and that takes time. We're not going to experiment on you and give you this virus. We have to see if you just get exposed to it by chance. And to do experiments like that is ethically difficult, requires huge numbers of people, and is just really hard to do. And that's really where the epidemiology and the antibody testing hits the road. That's
it's a tricky piece of this, but I just want to get your last thoughts here on that same thing that we did hear from Neil Kashkari when we're thinking about rolling openings and closings for economies as these cases start to pop up, because we're kind of seeing that now as it moves across the country. We get different hotspots. Detroit, we saw the first kind of hotspot outside of New York City and Louisiana and New Orleans, but that seems to be coming down as well in terms of case growth. But when you look at it, how would you actually advise local governments, I guess, to address this? Because a lot of them don't necessarily have the resources to maybe understand. We saw a lot of different reactions across the country in terms of even instituting social distancing. So how do you, as an expert in the field, give advice to smaller communities to say, all right, now this is on us, if it's not going to be from a federal approach, to handle all this?
Political transparency, honesty, and discussion, what we conventionally call democracy. And no one person can make a decision for all of us. And so it's really very local decision making, which has to be driven by science. All we can hope for is that vaccine production and testing proceeds as fast as it can, which is going to take a long time, a year or longer. We don't want a vaccine to be harmful, it has to be helpful. And maybe we'll come up with some sort of medication, a pill, that actually might either reduce the symptoms or even prevent somebody from getting infected. So to have a platform for doing that, that is something that doesn't exist right now. Yale School of Medicine and the Yale New Haven Health System, where we should have a platform up and running in a couple of weeks to actually test in the outpatient, the ambulatory setting, whether certain experimental treatments might prevent either getting infected or treat early infection. And if we could find that, I think that would be a true game changer.
No, absolutely. Well, Dr. Joseph Vinetz from Yale Medicine Infectious Disease Division, thank you so much for joining us. Appreciate it.
My pleasure. Thank you for having me, Zach.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.